Esophageal cancer is an oncological disease. Look at this picture, shows that esophagus and cancerous tissues. MRI findings, PET images, look at this, and CT findings. Look at this detail going on. Introduction. Esophageal cancer is a malignant tumor that originates in the tissues of the esophagus, the tube that connects the throat to the stomach. This cancer is associated with a poor prognosis as it is often detected at an advanced stage, making early detection and comprehensive management crucial for better outcomes. Definition: esophageal cancer refers to a malignancy arising from the epithelial cells lining in the esophagus, which can grow aggressively and spread to other parts of the body, often the liver, lungs, and lymph nodes. Types: 1. Adenocarcinoma often develops in the glandular cells of the lower esophagus and is commonly linked with gastroesophageal reflux disease. 2. Squamous cell carcinoma typically arise in the flat, thin cells lining the upper and middle sections of the esophagus and is linked to smoking and alcohol consumption. 3. Other rare types: small cell carcinoma, sarcoma, lymphoma, and corticocarcinoma can also affect the esophagus but are much less common. Causes. Here are 5 primary causes of contributing factors associated with esophageal cancer. 1. Chronic gastroesophageal reflux disease, GERD. 2. Smoking. 3. Heavy alcohol consumption. 4. Obesity. 5. Diet low in fruits and vegetables. Risk factors. Key risk factors include: 1. Lifestyle factors, smoking, heavy alcohol use, and a diet low in fruits and vegetables. 2. Medical conditions, GERD, Barrett's esophagus, achalasia, obesity. 3. Gender and age. More common in men and those over 50. 4. Family history. Having a family history of esophageal cancer increases risk. Complications. Complication can arise from the cancer itself or its treatment, including 1. Dysphagia, difficulty swallowing due to esophageal narrowing. 2. Malnutrition, poor nutrient intake from swallowing difficulties. 3. Metastasis, spread of cancer to other organs. 4. Tracheoesophageal fistula, an abnormal connection between the trachea and esophagus leading to severe infections. Pathophysiology. Esophageal cancer begins with changes in the esophageal cells, persistent irritation, causes cell mutations and dysplasia, progressing from pre-cancerous changes to invasive cancer. These abnormal cells grow uncontrollably, invading nearby tissues and spreading through lymphatic and blood system. The pathophysiology of esophageal cancer involves a progressive sequence of cellular changes in the esophagus. Here is a step-by-step breakdown. 1. Chronic irritation and inflammation. 2. Cellular changes, metaplasia. 3. Dysplasia development. 4. Formation of carcinoma in site. 5. Inversion and tumor formation. 6. Angiogenesis. 7. Metastasis. This step-by-step process highlights how chronic irritation can lead to cellular changes, dysplasia, and eventually invasive cancer, especially if risk factors persist without intervention. Signs and symptoms. Common symptoms include 1. Difficulty swallowing, dysphagia, particularly with solid foods, to weight loss without trying. 3. Chest pain or discomfort, for persistent cough or hoarseness. 5. Acid reflux or heartburn that worsens over time. Diagnosis. Diagnosis methods involves 1. Endoscopy, visual examination within a flexible camera to identify abnormalities and take biopsy. 2. Biopsy, microscopic examination of tissue samples to confirm malignancy. 3. Imaging, CT, PET and MRI scans to assess tumor spread and staging. 4. Endoscopic ultrasound, determines the depth of tumor inversion and lymph node involvement. Nursing management. Some possible nursing diagnoses include 1. Impaired swallowing related to esophageal obstruction, 2. Imbalanced nutrition less than body requirements related to dysphagia, 3. Anxiety related to diagnosis and prognosis of esophageal cancer, 4. Acute pain related to tumor inversion and dysphagia. Management, medical management. 1. Surgical intervention, esophagectomy, removal of part or all of esophagus is often preferred to chemotherapy and radiation therapy used in conjunction to shrinking tumors pre-surgery or as palliative care. Three, endoscopic therapies, photodynamic therapy and endoscopic mucosal resection for early stage cancers. Nursing management or nutrition support, assist with dietary modification and recommend high calorie, easy to swallow foods. To pain management, administer pain relief medications as prescribed and evaluate effectiveness. 3. Emotional support, provide information and reassurance to reduce anxiety. 4. Swallowing assistance, educate on proper swallowing techniques and avoiding high risk foods. Treatment options. 1. Surgery often include partial or total esophagectomy. 2. Chemoradiotherapy, combined chemotherapy and radiation to shrink tumors. 3. Targeted therapy, drugs that target specific cancer cells, proteins or mutations. 4. Palliative care, symptom relief and quality of life improvements for the advanced cases. Psychosocial medicine. Here are 5 social medicine aspects important in addressing esophageal cancer. 1. Public health awareness and education. 2. Screening and early detection programs. 3. Socioeconomic support for nutrition and lifestyle counseling. 5. Mental health and psychosocial support. Prevention. Preventive strategies involve reducing exposure to risk factors. 1. Lifestyle changes, quit smoking, limit alcohol and maintain healthy weight. 2. Diet, increase intake of fruits, vegetables and whole grains. 3. Manage GERD. Proper treatment of acid reflux and avoiding triggers can lower the risk of developing Barrett's esophagus. In conclusion, esophageal cancer is challenging condition requiring multidisciplinary approach for optimal management. Early diagnosis and intervention can improve outcomes, while preventive measures can help reduce the incidence. Effective nursing care, patient education, and support play crucial role in patient recovery and quality of life. Thank you. Have a nice day.